Hey everybody, today I'm here at Dr. Weiler's brand new office in Denham Springs. This place is gorgeous. There are 3 locations now, Baton Rouge, Hammond, and Denham Springs. You can get the same aesthetic services here. There is a fantastic staff, and of course Dr. Weiler is here as well. So, what am I doing here? I'm the patient today. Today I'm going to be getting Botox. For those of you watching out there that are considering getting the procedure, here are a couple reasons why I get it. Botox helps me feel a little less tired and a little less stressed. Who doesn't want that? The procedure really erases a little bit of that for you. Whether you're stressed or tired from working or dealing with the kids, Botox helps you with that. Secondly, Botox just shaves off a couple of years. Who doesn't want to look a little bit younger? I'm not talking about 10 to 15 years, but a couple of years we'll all take it. And guys, don't be afraid. This is for you as well. So I'm here to show you that it's an easy procedure. Don't be afraid of it, and the results are amazing. Let's go meet Dr. Weiler. Here we go. As I said before, I've had Botox done before, and I love it. I am a big fan of it. So Dr. Weiler, talk through, there really isn't any prep work involved in having Botox.
Minimal prep work, and thank you for allowing us to do this on camera
Yes.
today. I know this is a big step. Very personal to share this with our audience. So I tell patients there really is minimal prep for this. All of our Botox here at Weiler Plastic Surgery is done by our providers. We've got a staff of 4 wonderful female providers. They're either nurse practitioners or PAs. They've been with me for years. They've all been extensively trained. So we do have another physician, Dr. Daughtery, that does do the Botox and the fillers, but I myself mostly just operate. Okay. So now I have done this for years, and I used to do lots of Botox, but I've gotten too busy. Okay, good. So typically we tell patients there really is minimal prep work. We do recommend, you know, if you do take a lot of NSAIDs, you may want to lay off that because it does increase your risk for bruising. You always ask about bruising, right?
I do. I ask about bruising. I usually come in and get my Botox either before work or on my lunch hour because it's so easy. And I have never experienced bruising before, but I know that you said there could be bruising.
It is rare, but there's always the potential. I think I personally maybe bruised 1 or 2 people. One of those people is my wife, of course.
We know how she felt about that.
Exactly. So the potential is always there, but it's extremely rare. It's a very quick procedure. I always tell patients it's important that when you pick your Botox provider, they understand, they have a thorough discussion with you, they have the ability to really deliver the results. You know, Botox is available on every corner, right? And one of the problems is that most providers, or providers that don't do a lot of it, have really cookie cutter approaches. They use the same techniques and the same sort of dosages for everybody, right? And so that really doesn't personalize the process, and we try to personalize the process.
Well, it is personal. I like to talk to my doctor and who's doing the procedure to make sure you understand what I want to hopefully improve upon and what I want left alone.
Right, and one of the things you told us before was about your eyebrows, right?
Yes, so I have had a bad experience with Botox before. It wasn't here at Dr. Weiler's. But it essentially was too much Botox, and I had, my eyebrows were really high up, and I had that surprise look. No one wants that. Right. Or maybe they do, that's okay.
Some patients need that to make their face more youthful.
Yeah.
So, and for some patients, it's actually a benefit. For lots of patients, it's not a benefit, it actually looks bad. Yeah. So, you know, it's important that you work with your provider. She's had an extensive discussion. She's gonna really tailor the Botox. And when we say tailor the Botox, that does mean tailor the price too. So we tell patients there will be differences in the prices depending on what you want. Yeah. And then you're gonna visit back. We're gonna clean the areas that she's going to inject the Botox. Elizabeth is, we are actually filming this right before work, is that correct?
Yes, I was gonna say, Dr. Weiler, for the ladies that are watching, I recommend bringing a little makeup with you so that obviously after Claudia preps your skin and takes some of your makeup off, you can touch it up to go back to work without any issues and no signs. Absolutely,
and so one of the things we also offer here, since we're before work, is we do offer appointments before work, during your lunch hour. One of the things we stress is same day Botox. So I tell patients is, what that means is, let's say you get off at 2 o'clock and you want your Botox at 3:30, give us a call, we will fit you in and we will find you a provider, okay? All right, so she's gonna start, she's prepped. She's got the Botox in her hand. She's gonna do a few injections and I'll kind of talk you through this and she'll kind of talk you through this also. She'll make her do some muscular movements there. She grabs the skin, does a quick little injection. Obviously, it is a needle, so you will feel a little stick. You will have a little welt underneath the skin for about 20, 30 minutes.
It feels like a little prick, like you said. It is a little needle, but it's not painful at all.
It's a small little needle. Obviously, the face is a sensitive area, and we tell patients is that, you know, I myself get Botox, so I've experienced it also, and it's
I have
really
guy friends that do it too. So.
it makes. I think patients tell me it makes a significant difference in my appearance and how young I look.
Dr. Weiler, I was going to say one of the other things that I really like about Botox is because you feel refreshed and you do look a little bit more youthful, there's some confidence with that.
Yes,
you know,
absolutely.
in our everyday lives. So I find that that's a big advantage as well.
Absolutely. Good. So she's treating what we call the crow's feet. And the crow's feet area is an area that, especially in men, shows the age, and in women. Some people call these laugh lines also. It's an area that's going to smooth around the outer eye. It allows better makeup application, and it really kind of gives you a more youthful appearance.
Laugh line sounds so much better.
It does than crow's feet. So there's all different types of monikers and names for all these little areas that we get on our body. And remember, I tell patients, you know, what is Botox? Botox is a botulism toxin. What happens as you age, your muscles are constantly contracting. And most of these muscles are contracting. And think of your skin like a piece of cardboard. And as you continue to crease that cardboard, right, those sort of lines get deeper and deeper and deeper. And so what Botox does is it really prevents the creasing of that cardboard, allows it to smooth. And by allowing it to lay flat, those lines start to disappear. And she's going to inject, so right here, she's going to inject what we call the 11s or the mean lines. She's going to kind of shift your face a little bit. And so, that's perfect expression right there, exactly right. I tell patients that this is an area that probably is the most common area to inject. I get this injected myself. I have a deep, heavy brow. And I tell patients is that, you know, especially moms and dads, from scowling at their kids or being tense or upset at work. This is an area of stress, exactly. And this is also an area where Botox was discovered to relieve migraine headaches. So we typically tell patients it takes about 5 to 7 days to see your results. We're gonna follow you back up to 2 weeks, and typically it lasts for about 3 months. Some patients it's a little bit quicker, some patients it's a little bit more. Everybody's body processes the toxin at a little bit of a different rates. But one of the benefits also of coming to us is that we do a ton of Botox. So your Botox, I can guarantee you, has been freshly mixed and opened. I can guarantee you it's been opened that day, if not within that hour or two, because we have so many patients that come through. And that's another important aspect, because Botox does lose its potency as it sits in that doctor's refrigerator after being mixed.
I didn't know that, Dr. Weiler.
Yeah, and so that's one of the things patients don't realize. We have lots of patients that come in and had a bad experience in the clinic. And we don't, you know, name names or try to bash, but I tell patients it's really, you know, you have to do a lot of volume of Botox to be good at it and to really have fresh Botox. So it's important that you visit a provider that does a lot of Botox.
And for me, it is about every 3 months that I want to come in and get it done again.
Right. And you know, and obviously, I'm aware of patients' concerns. This is not a cheap procedure. This is a procedure that's well worth it. It's the world's most popular procedure. It's a very quick procedure. It really is a lunch break procedure. It's not as involved as fillers, say maybe getting your lips enhanced or maybe filling some deficits or some volume loss in your face. Those are a little bit more complex. So this is a really quick in, it's a quick out. Apply a little bit of makeup, all done, right?
That's it.
Got a little bit of redness, which is to be expected.
A little redness, but I'll touch that up with my makeup.
Correct.
And I'll be good to go.
Yeah?
Yeah.
You did great.
Lunchtime hour. Thank you, Dr. Weiler.
Good.